There's a storm across the valley. The clouds are rolling in. The afternoon is heavy on your shoulders. There's a truck out on the 4-lane, a mile or more away. The whining of his wheels just makes it colder.
Welcome to Community Forum. My name is Priscilla Almquist Olsen, your host, and today is Friday, February 24th, and I welcome to our program Reverend Crayton, Reverend Dr. Crayton, and from Brockton, the Lincoln Ministries, and also Dr. Faina Shtern, and they have a collaboration, and it will be so interesting to learn about that. And I appreciate both of you coming today. So tell me, what is this collaboration all about?
Actually, I met Reverend Crayton in 2015 when we initiated prostate cancer awareness campaign in Plymouth County. And the first meeting with Brockton NAACP, our main partner in Plymouth County, was in Reverend Crayton's church. So when we started, after so many years of collaboration, when we launched a new program, which is called Prostate Cancer Equity Program, Reverend Crayton was one of the first people we went to get his guidance, how we can get information about this program to the community that needs this program the most. The goal of this program is to expedite access of Massachusetts men to leading experts in the state who can provide the best care available today and to take care of men every step of the way during their medical journey. Reverend Crayton, do you want to comment?
Oh, yes, I think it's a great program, and I'm so happy. To me, it is a community service, but I also see it as a ministry. I have a tendency to theologize everything. So I see this as a ministry because I believe that God is also interested in your natural man as well as your spiritual man. So we put a good amount of time in trying to help people naturally. And, we have a number of programs that we have, and I even had some jobs programs, but this is one of our first major health programs that we're adopting at the church. And we find this to be a great help so far to the community.
Well, my first question is, what program does ADME Tech Foundation have to improve patient care for prostate cancer and reduce health disparities toward African-American men, is it not? So my question is, how does this foundation improve patient care and reduce health disparities? And we know there are many health disparities between for in Black men who don't get the same medical service that other people get. So Dr. Shtern, can you address that?
If we look at various disparities in cancer in general, there is no other malignancy that comes close in disparity in death rate to prostate cancer. Prostate cancer is a leading cancer disparity. Black men are dying at the rate of roughly 2.5 times higher compared to white men. It is unacceptable. We chose to work in Plymouth County in 2015 because at that time, Plymouth County led the state in Black mortality. And the disparity between Black and white men mortality was even higher than state average or national average at roughly 2.75 times higher in Black in Black men. So we focused on Plymouth County with Brockton NACP, with Reverend Crayton. We, in order to address this disparity, and just based on education and awareness, we managed to reduce mortality in Black men by roughly 55%, in white men by 30%, and reached and we decreased disparity ratio by more than 55%. So right now it's roughly 1.2 times higher for Black men, which is much lower than state disparities or national disparity. And this is education alone. So the new program, Prostate Cancer Equity Program, addresses not only education and awareness, but also direct access to the best experts in the state.
So the Prostate Cancer Equity Program allows those who participate to get all the best references and resources that are available.
Absolutely.
When would you recommend men have prostate cancer screening?
For men who have risk factors like Black heritage, we recommend for them to start conversation with their doctors about prostate cancer screening during annual exam at the age of 40. Even if your doctor does not start conversation about screening, please do so. There are different controversies which are not justified about PSA screening outside of expert community. And unfortunately, it's very frustrating for an expert to see these discussions, which are poorly informed, because if we look at the history of cancer screening, blood test PSA for prostate cancer screening has been the most effective tool in the history of cancer screening.
Can you tell me, Dr. Shtern, what does that screening involve?
It's a simple blood test, PSA testing, and that's the most important thing. Now, when you go to the expert for screening purposes, it is also likely that expert will choose to do digital rectal exam. But by the time digital rectal exam is positive, more frequently than not, tumor has grown. So PSA blood test can detect cancer very early, long before physical exam. Although I have to say, in a small fraction of people, PSA test is, but it's like less than 10%. PSA test may be normal, while digital rectal exam may be abnormal, but it's a minority of men. So our focus is to make sure that men get screening with blood test PSA.
Oh, okay. I mean, I know that the PSA is, I don't remember exactly what that stands for, but it's a number. And what is that number that tells the patient that he's okay?
As long as PSA level is below 3,
okay,
it is patient is probably okay. If it reaches 3 or above, it is really important for a man to ask his primary care physician for a referral to an expert who can do further clinical evaluation. And you are welcome to come to us, 617-523-3535. And please ask for Prostate Cancer Equity Program coordinator, and we'll be happy to refer you to some of the best experts in the state.
Wonderful. My goodness. That's a wonderful resource that you provide. What can men do if their doctors express concerns about their screening results and recommend invasive biopsies?
Right now, over the last 5-6 years, we've seen such incredible advances in precision diagnostics, blood test, urinary test for molecular markers, genetic markers. We also, Almquist Foundation has been leading development of very powerful imaging tool called magnetic resonance imaging for prostate cancer. So before you get by, the old style was if PSA was getting level of PSA was of concern to physician, or there is another reason for clinical suspicion, such as digital rectal exam, men were referred directly to biopsy with no other diagnostic, non-invasive diagnostics administered. Right now, there is plenty of non-invasive diagnostics to determine if men need invasive biopsy and how to do this biopsy with greatest possible precision. So it's very important to discuss with your doctor, if biopsy is recommended, what non-invasive options are available to you before biopsy is administered. And again, please come to our program. We'll be happy to also refer you to physicians who have these diagnostic resources and high quality MRI.
And the program that you represent is the ADME Tech Foundation. Is that correct?
And our specific name of the program is called Prostate Cancer Equity Program. By that, we mean clinical equity.
Yes. Okay. And we're going to post all that information at the end of this interview.
Thank you so much.
People can see that, write it down, and so forth. What is your perspective on genetic testing for men who have a family history of prostate cancer?
Absolutely critical. There are different kinds of genetic testing. One type of genetic testing can be done through a blood test, not dissimilar to what women have for breast cancer. And actually, these are similar genes. Breast cancer and prostate cancer run in families. So when there is a family history of prostate cancer, it is really important to consult experts, and experts will determine if genetic counseling or genetic testing should be done. If genetic testing comes out positive, these men need to be monitored extremely carefully and closely.
What are your thoughts about the rapidly expanding use of active surveillance or careful observation, just wait and see, we're going to wait and see attitude that has replaced invasive treatment for many men?
Thank you so much for your question. It's really important. The way it happened, let's say 10 years ago, just about every man diagnosed with prostate cancer was sent for very invasive surgery, which we called radical surgery, or very extensive radiation treatment. It is no longer the case. Once again, because of precision diagnostics, we now know which men have the kind of cancer which we call harmless, if it is appropriate to say for prostate cancer, but it is essentially harmless. This is a cancer that is not likely to grow. It is not likely to cause symptoms. And for this man, surgery or any other kind of invasive treatment is not appropriate. What is more appropriate is careful observation or active surveillance, as you mentioned. And if we see at the patterns of care, we will see that 10 years ago, only 10% of men were referred for careful observation. As of 5 years ago, according to the best data we had, more than 40% of men to 60% of men currently diagnosed with prostate cancer are referred for patient surveillance, for active surveillance, and they do not need to have treatment and related complications. And yet they need to be obviously watched closely.
That is so interesting. I mean, I think most people who are watching this program are totally unaware that there is a so-called harmless prostate cancer. But you're speaking about the advanced imaging that we women, of course, have been benefiting for many years to detect breast cancer. And so now there is advanced imaging for men, which will determine the status of their prostate, whether it's healthy, whether it's a harmless prostate cancer, or whether it is advanced. And the PSA blood test will give us a number, but the advanced imaging apparently seems to be the most effective in combination with the blood test for most men. And that is really a news flash, isn't it?
Absolutely. And that's why it is so critical to have access to the best care available today, because physicians who provide services for prostate cancer equity program at Mass General Brigham, at UMass, in particular, have access to the best diagnostic tools that can determine which individual man needs biopsy or does not need biopsy, what kind of biopsy, which individual man needs treatment or needs just careful observation, and what kind of specific treatment would be beneficial for this particular man.
Oh my goodness, this is really revolutionary, isn't it?
Yes, it is. We've truly seen transformation of prostate cancer care over the last 5 years. But we also have a concern, and our concern is if we do not give equal access to everyone to these incredible advances, we will see widening gap in mortality between Black and white men.
But yet your program that began in 2015 in Brockton has had phenomenal results.
Yeah.
And it's all about education. It's about testing. It's about getting the right physicians who have the expertise and current knowledge, especially the advanced imaging. So what is your message to families out there, mothers who have sons and husbands, and what is your message? Because I have a son who's 46, he'll be 47 in June, and I'm just wondering if he's ever had a PSA test. And so I'm going to certainly ask him and recommend that he take care of that, because his grandfather had prostate cancer.
Every man should have, according to the National Comprehensive Cancer Network, consisting of 28 leading cancer hospitals in this country and the best experts this country has, men should have PSA testing at the age of 45 at the latest. We call it first or baseline testing, and this testing is absolutely critical for us to determine which individual man is at increased risk of aggressive prostate cancer, life-threatening prostate cancer. So the entire screening program can be designed based on this single test at the age of 45.
Oh my goodness, that's wonderful news. So what are your parting words? What are your recommendations?
It's really important for me to say that I believe that prostate cancer equity program that will provide best care to everyone is the fundamental solution for eliminating healthcare disparities in prostate cancer. I had the privilege of leading all the imaging advancements in breast cancer that you mentioned at the National Cancer Institute as a head of diagnostic imaging. And we modeled all the prostate programs after breast imaging programs we had an NCI, but in a private Admitech Foundation. Prostate Cancer Equity Program is here. Help is here. Please come to us and allow us to help you.
Well, that's a wonderful message. Thank you. And I know that Brigham Women's Hospital is one of the leading hospitals in the world, let alone the country. And we are so privileged to have that facility just 25 miles away from Easton, from Brockton. So we thank you so much for all of that. And I want to switch now briefly to Reverend Crayton, because he knows the people who have been impacted positively from your program. Reverend Crayton, are you there?
Thank you so much, Priscilla. I'm sitting here. I'm so excited about being on this program with Dr. Shtern and yourself. You're an excellent host. I hope to use you in the future. Being an attorney, that really adds to your expertise, and you're a very skillful host. And I really appreciate you, and I appreciate Dr. Shtern, the Ukrainian doctor, and she's here helping us in the United States, and I pray that we are helping her family and people back in Ukraine. I have a lot of experience with Russian doctors, Ukrainian doctors in the past. I think we're really on to something, and we're in a place that we can really be help to people. I have a friend, one of my best friends, Dr. Ozzie Edwards, pastor of Elliott Congregational in Boston. He was part of our consortium of churches back in the 90s. We were in K&G shopping for suits, and he came up to a few of the ministers and said to us, "You gentlemen, get your PSA test, get your prostate cancer test. Don't do like me and wait too late." And I didn't understand what he was talking about until 2 weeks later, they told me they were having his homegoing service, his funeral service, and it was a shock to the community. He kind of kept it quiet. Judge Outlaw, one of the historic judges in Boston, he was just beside himself. And ever since then, I had an endeavor to do something in the area of the prostate cancer because we lost a lot of people. I know people personally who have succumbed to that. And it
But now
was
that
only a matter of being tested in a timely way.
but now that's all changing, and it's been a miraculous change because Dr. Shtern described the reduction in prostate cancer
Yeah,
patients and getting it early, or just finding the right, getting the imaging, getting the testing, PSA
right.
testing, and so forth. And all of those resources that the foundation provides have really decreased the pain and the grief that Brockton has experienced since the 1990s.
Yeah.
Isn't that true?
Yes, yes, yes.
How does your congregation feel about this, having been the host of this wonderful program?
Oh, they were excited, and everybody's been mobilized to share the flyers that we received from Dr. Stratton and the Admitech. And I just ran into somebody else who I didn't realize I was working with Dr. Stratton, a nurse, an RN, male nurse, Richard Green, and I've known him for years. And of course, when in the military, I was a hospital chaplain as well, and I was stationed with Combat Support Hospital for years, and also Veterans Hospital chaplain as well. So I have a group of men that I'm addressing now, and I'm trying to get them to be advocates individually at the VA hospital here in Brockton. But at the church, we have my age. We have a lot of people up in the borderline retirement age, and their husbands are at that place where they really need to pay attention to these type of things. So they're really involved in this at Lincoln, and we're the kind of church that's very public. Everybody knows about Lincoln Church. We've been here since 1897, and I haven't been here since 1897, but the church has. But so they know us, and the mayor and everybody were very close friends. I'm pretty politically active in the city. Been for years, and we've done a number of things. I have the ministers. I initiated Ministers of Color Urban Alliance back in the 90s. That was very successful. And so I believe Steve Bernard, he knew of my work, and Dr. Stern shared with her. I'm one of the few, I guess, senior pastors in the area right now. They say I am one of the senior pastors, 36 years at this church. So I know pretty much, and I'm pretty much in contact with some of the newer pastors that have come into the area. The Haitian congregations and the bilingual congregationals are really prospering in the Plymouth County area. So I have some that I share with regularly, and I'm trying to get them involved as well. It's a very, very strong and large Haitian population in the area. So
I think it's so important what you're doing, and because so many of the members of the Black community go to church, and therefore it's a wonderful means of communication for this program. Now, but my other concern is, what about the Brockton Department of Public Health? And this is probably a question for Dr. Stern also, has any has the Department of Public Health created any type of communication program to get the word out to all Brockton citizens?
Actually, I'm not in a good position to address this issue because we are working primarily with Brockton and AACP as a partner, also with Good Samaritan Medical Center since 2015. And we sort of, and it was actually Brockton and AACP, particularly Steve Bernard, who contacted the mayor, the city council, Department of Public Health. So I am not familiar about specific actions taken by Brockton Department of Public Health, but I assume they've been involved by Brockton and AACP.
Yeah, because I think the Department of Public Health is certainly a wonderful means of getting the word out. And I'm just hoping that they do have an aggressive program to get the word out so that members of the community will know about the services that you provide and all those wonderful resources. So maybe Reverend Crayton, you could check on that for me. I'd appreciate it.
Yes,
And
certainly will.
okay, and so this program is part of the Eastern Community Access Television, but what we will do is we will send a link to the Brockton Community Access TV so that all people can learn about that. And if there are any other communities, Reverend Crayton, that you feel would benefit from this interview, please let us know. Any parting words, Reverend Crayton?
Oh, I'm just I'm elated. Thank you, Dr. Shtern, as well. I feel blessed. I'm honored to be able to work with you, someone as renowned as yourself, and especially at a time like this. It's just a coincidence that we're dealing with the Ukraine on a pretty large scale politically, and it's affecting us socially in this country and over there. And here I am. I'm working with a Ukrainian doctor who's great. She has a lot of energy, and she makes me feel young, just hanging around her. And so I thank God for your vitality, energy, and also our host today, Priscilla. I've learned to really love her. She's really gifted and talented, skillful host. I hope to be able to utilize her later with some of the initiatives that we're taking part in. But thank you again, Dr. Shtern, for considering me and the kind words that you shared about me. I really appreciate that. Coming from you, it means a lot.
Well, thank you so much, Reverend Crayton, for those very kind words. And Dr. Shtern, it's been a real honor to host you today and to be able to facilitate getting your message out. And I hope that those viewers, people who are listening, will take advantage of this incredible information. Certainly, I consider myself a pretty knowledgeable person, but I didn't know about the imaging aspect of this and the fact that one doesn't have to have an invasive procedure if one has the imaging to see exactly what's going on in there. So I appreciate that. And I have, I know many people, people I have loved and cared for who are no longer with us because of prostate cancer. And they did have invasive procedures, whether it was surgery or radiation, and it affected their lives. And it's just such a sad, tragic story for men, because I think most men, majority of men, are going to face prostate cancer at one point or another. Isn't that true?
Yeah, 1 in 8 men are diagnosed with prostate cancer. Among Black men, it's roughly 1 in 6 men will be diagnosed with prostate cancer in their lifetime.
Well, that is really extraordinary amount of men. I mean, that is just a horrible prognosis, but we have good news now, thanks to you and your project and the advancements that have been made in recent years. And I do hope that those of you who are listening and viewing this will be sure to write down the information that we're going to post on this at the end of this program. So thank you again, Dr. Shtern. You are quite a treasure to the medical community and certainly to all the men in your life and in our lives. Thank you.
Thank you so much for the opportunity. Reverend Crayton, thank you so much for your partnership, for this opportunity,
Yeah.
for so many years of support.
8
Yes,
years.
yes.
And so to you, you who are listening out there, hopefully you will take advantage of this wonderful information. And so this is Priscilla Almquist Olsen, wishing you well and be well.